Hi, I'm Dr. James Meschino. What causes PMS or premenstrual syndrome? Well, as you know, PMS is sort of a cluster of variable symptoms that, affect women often 7 to 14 days prior to menstruation and usually disappear around the time that the menstrual flow begins. But, in some women, they get very painful dysmenorrhea or, painful menstrual cramps, which can also, make things very debilitating for them for a few days longer. And it's interesting, about 1/3 of women report having PMS symptoms, especially women between the ages of 25 and 40 years old. And in about 10% of cases, the symptoms are extremely severe. So, the symptoms, manifest in different ways. There can be, things that affect you emotionally, where you feel depressed or nervous, or there's irritability, anxiety. And there's also intestinal symptoms that can result. Abdominal bloating is very common. But also, weird cravings for sugar or chocolate, as well as, constipation or diarrhea can occur during that time of the month. Changes to reproductive tissue, of course, breast swelling, breast tenderness, uterine cramps. And of course, headaches are often worse than a feeling of backache or sort of a gnawing back pain. And, swelling of the fingers and the ankles is not uncommon as well. So, any cluster of or constellation of those symptoms can occur. What's at the root of this? What are the causative factors? Why does this happen? The underlying consistent finding in PMS appears to be an imbalance between estrogen and progesterone, where your estrogen to progesterone ratio is just too high. So there's too much estrogen, not enough progesterone, about 5 to 10 days prior to menstruation. How does this happen? Well, from a faulty dietary standpoint, you can get your body to produce too much estrogen. At the same time, if your liver's not detoxifying the old estrogens fast enough, then that will also elevate your estrogen level. So you can have too much estrogen by dietary factors that increase estrogen levels, or by slowing down the estrogen detoxification, which can also be managed through diet to a certain degree. Another common reason is that sometimes in the ovaries, the corpus luteum doesn't secrete enough progesterone, so that's going to give you this imbalance as well. So it is this imbalance, though, in estrogen to progesterone that we see is at the heart of the problem, because that imbalance leads to a change in endorphin levels in the brain. So when your endorphin levels drop, you get mood swings, depression, anxiety sets in. It affects how you feel. And that imbalance also creates excess prolactin to be secreted, which causes sort of fibrocystic breast disease, hyperproliferative activity in the breast tenderness and swelling can result from that. And the elevated estrogen also increases the release of aldosterone, which holds water and salt in the body, so those symptoms of swelling and bloating and water retention are due to that aldosterone effect, we think. So, when you have these symptoms and they're severe, you seek medical help, and medical doctors are sort of hamstrung. They're not really sure what to do. So, women sometimes have very severe symptoms, so they'll prescribe oral contraceptive drugs or the birth control pill, which sort of overrides all of your natural hormonal secretions and takes control. But I don't think this is actually the best answer. The best answer is to try to just bring the estrogen to progesterone ratios back into balance, which I'm going to talk to you about. Sometimes doctors will prescribe other hormones that will sort of, block the ovulatory cycle. Or if you're feeling depressed, they'll give you an antidepressant. If there's a lot of anxiety, they'll give you an anti-anxiety drug. If there's a lot of water retention, they give you a diuretic drug. If there's a lot of breast tenderness, you get a painkiller. Menstrual cramps, you get a muscle relaxant. So really, that's just chasing the symptoms around the body. It doesn't really get to the cause. The peer-reviewed clinical studies in medical and scientific journals shows very conclusively, and I've seen it in my own patients, that the right diet, lifestyle, and supplementation program can actually bring that estrogen to progesterone balance back where it belongs and help to remedy most of the symptoms of PMS and dysmenorrhea in a high percentage of cases. So a lot of doctors are not trained in the area of natural medicine and nutrition. So what I've done is I put all the information together for you in an ebook that you can download right here for free. It's called The Natural Management of PMS. If you suffer from PMS symptoms, whether to a severe degree or to a modest degree, you should download it right now. not only will you see the comprehensive program, but I've included all the scientific references so you know you're getting only solid scientific information. So now this brings me to the other fact, and that is that at meschinohealth.com you'll see other research review papers that I've written. You'll see other videos I've created, footage from my live academic seminars, other resources and downloads that I've created that are all there for free that will help you lead a long, healthy, functional life. All my research articles and teaching materials have all the scientific references in them, so you know you're getting only sound, scientific, evidence-based information on any health topic that you're looking for. So you really should make meschinohealth.com an ongoing, reliable resource of health and wellness information for both you and your family. Thanks so much for watching.